Welcome to Morning Infusion with Dr. V, where we are intentional about connecting you with other entrepreneurs that have overcome and want to provide value to the audience. It's Dr. V here, where our coaching program teaches nurses how to work from their computers anywhere around the world, making money and owning their own time. So today we have a very special guest. She is my friend, Kendra Mickens. We actually went to school to get our master's together. And we had an amazing time. Kendra was super smart and just super fun to be around. And so Kendra, tell us a little bit about you. So give us kind of your bio in short form. If people were to introduce you, what would they say about you?
First thing they're going to say is kind of going into my role of becoming a nurse is it all started at North Carolina A&T State University. So Aggie pride. So we Aggies are everywhere. So it's going to start with some Aggie pride. And, a little bit of coming into the nursing shortage that is. The old school is that you would have to go into med search first. And I did not, because with the shortage, I was able to go into my passion, which was high risk obstetrics. I am everything that goes wrong in a pregnancy. I believe that pregnant hormonal women need love too. So I'm here for the pregnant hormonal women, especially when something's going wrong in a pregnancy. They need a little extra woo-woo-woo. So went into high-risk obstetrics and then eventually transitioned into just women's health and going into the ambulatory setting, and then took another turn as we do in our nursing career and ended up being a school nurse and working with high school students, and then had an opportunity to go into education at a practical nursing program. So once I went into education, I was like, I think this is it, because as nurses, it's kind of like, where am I going to stay? And I still have a love for high-risk obstetrics and maternity and women's health, but education seemed to be the fit for me. So that's when I ended up getting my master's with a focus in nursing education. And it has stuck. It has been the thing that rang true for me, ending up in nursing education. And from my master's program, I ended up doing a preceptorship with simulation in healthcare. And did simulation in healthcare, became a certified healthcare simulation educator. So heavily involved in the Society for Simulation in Healthcare right now. And just with the pandemic, seeing the need to support more of a nurse focus, I ended up then transitioning into nursing professional development, but stayed within my system, so I still get to do simulation.
So simulation, what is simulation?
So simulation, there is a ginormous push, and it has been in the medical field for a long time, starting with anesthesia. So it is the use of, low tasks when we look at trainers, when we look at low fidelity trainers. So simulation is more than just the mannequins, because the mannequins that they have had humongous strides in the realism. So a lot of times people think simulation is just the mannequins, but there's a lot of low fidelity simulation.
Okay, wait a minute. Low fidelity. What does low fidelity mean?
So when we look at simulation, there's high fidelity, where we're looking at things like the mannequins, and we're talking about these mannequins. Now they're operated to the point where they can turn and look at you when you speak to them as they're being operated. And then low fidelity are things like, honestly, when you get an orange to teach a student how to give an injection, it's a simulated injection. Gotcha. So a lot of times we have done simulation in nursing as well. It just has not been as focused as it has been in the medical field with anesthesia. And pretty much now, if you are a medical school, you have some type of healthcare simulation tied into it. That's an integral part of your education. And same thing with nursing schools. I would say probably over the last 10 to 15 years, almost every nursing school has a simulation lab, not just the lab where we have those mannequins that don't have any electronics built in that we use for the head to toe assessment. Most nursing schools are getting the mannequins that have electronic functions, so that you're listening to the heart sounds, listening to the lung sounds. So the push is going to be here. Like I said, the technology with these mannequins is amazing. And it's truly the whole thing about it when we look at best practice standards are that we're looking for it to be a safe environment for you to still learn, but to have more realism about it, to be able to talk to a
Right.
patient and have the patient
Right.
respond to you, although it's probably an educator responding to you. Um, but it gives you an opportunity to work through these scenarios because honestly, in nursing school, even when you go to your clinical setting, you're not going to take care of a patient who just had a heart attack or
Right.
is ruling out a heart attack. Those aren't the kind of people that you get to take care of. But
Right.
in simulation, it allows you to be the primary nurse as a nursing student or as a medical student or as a resident. It allows you to be that primary person to look at their medications, to look at the rhythms, to have those conversations with the doctor, so to speak. It is not comfortable having a conversation with the doctor for the first time and trying to keep up with that good old S bar,
Mm-hmm.
and trying not to diagnose and stay within our scope. So it's really nice to be able to do it in a simulated environment. And then the simulations are set up so that then you have a debrief after so we can talk about it. And we always focus on what you did well. And then we take it back and we look at, well, if you could stop, rewind, and do it all over, is there anything you would change? And then it's typically set up where your other class can watch. And we already know when you're watching, the pressure is off. You still learn. You still learning, but you don't have the pressure of having to make the right decisions. And you kind of have that higher ceiling view of what's going on. And we give them an opportunity to also provide feedback on what they're seeing in the situation. So I love the use of simulation as a adjunct and a support for education in general.
And that's important because I mean, the first time I talked with the physician, they were like, he cusses all the time. And I was like super scared. I was like, oh my God, does he cuss all the time? But they were like, he doesn't cuss at you really per se. He cusses at the situation.
Right.
And so it was really good for me to have that first encounter with him where he cussed at the situation. But then of course I encountered a few over these 30 years that have cussed at me. And I'd be like,
Right. Right.
look, bruh, look.
Not the
I'm not
one.
the one,
Not
okay?
the one.
I'm not the one, all right? So anyway, I love it. So now tell us why you started because that is huge, right?
Mhm.
Because 30 years ago we didn't have that, right?
Mhm.
We learned how to make beds, right?
Right.
And we learned nursing theory, but we're not gonna go into that, how I feel about that, because let me tell you, I feel some type of way
You
about
feel
it.
away. You feel away.
But anyway, so let's get into why you started the business from the beginning. So tell us what you do in your business.
So in my business, it is the breakdown.
Okay.
And at the breakdown, that's exactly what I do. I break down nursing content. I break down how to properly study because during my time of being an educator, I got to see firsthand that it's not a given that students actually know how to study. And honestly, that's not a class that they teach you. They tell you to do it, but there's not a step by step of how to properly study. It's something that is a little bit of an individual development, but that assumption goes a long way to kind of contribute to why some students aren't successful. It's not because they're not putting in the time, it's because they don't know how to study. On the flip side, we know the joy that is a nursing test. And a nursing test is okay, I saw, yeah, right. Right. So when it comes to picking the right answer, there's a strategy to it. And it is like no other multiple choice you have ever seen. And of course, I'm not sad that select all that apply did not exist when I was in nursing school. So having to come up with strategies for that, students need the strategies to take the test because once you fix the studying, you then can know the right answer, but they talk themselves out of picking the right answer all the time if they don't know the strategies to do it. So then nursing content, sometimes literally they don't get it. They don't get it. And when I was in front of students, I did what I call reading the eyebrows because you present the information, right?
Mm-hmm.
And sometimes through the presentation of information, your student gets it. But then other times you present the information and I'll go, so are there any questions? And what's looking back at me is this. have a question, and I would go, so reading the eyebrows in the room. I see that we still don't get it, so let's break it down. And it was my students who they would take all their notes initially, and then they would have their pens and pencils, and they'd be like, okay, now break it down for us. Okay, now give us the breakdown. And so and for me, my philosophy when I went into teaching and truly teaching the students, because as nurses, we teach all the time. I was a weekender. You don't have as many resources on the weekend. When these people are getting discharged, you're doing all of the patient education. So I was not new to teaching at all. But the concept of teaching material to a nursing student, so that it's a twofold, almost a threefold. I need you as a nursing student to be able to pass your NCLEX. So my focus is always the NCLEX, which is just another thing that I, of course, focus on in the business. It is NCLEX prep. But as a nurse, it's so much more than the NCLEX, because the NCLEX test is an introductory test that says, as a new nurse, I believe you can safely at least practice. Then I feel like as a nursing instructor, you have to prepare them for the real world and let them know that textbook is a nicety. Like, the person coming in with textbook signs and symptoms, it's never that easy.
Never.
So truly giving them a realistic picture of what you're facing. So yes, NCLEX is information, critical thinking, all of that happens in nursing school, but then you have to be prepared for all of these other things. That is the environment that you're coming into. And of course, no school prepared people for coming into a pandemic. We weren't prepared for that. And so that was just yet another curveball. But you have to prepare them to pass that test, the NCLEX, just so they can get their license. And they have to understand how they're going to operate in the world, just as they're transitioning from a nursing student into becoming a new nurse. But then also they have to be able to safely take care of patients. So it's one thing to know how to pass the test. It's another thing to kind of feel like you are getting your arms around just what it is to be on the floor all day. But then you got to be able to do it safely. So that thing of instilling in students, it's so much more as a nurse of what you do when no one's watching you.
That's right.
Yes, you have people, the patients, you have family all the time with eyes on you, but there's a lot that you do as a nurse when no one is watching you.
That's right.
And I need you to have that center in yourself, that ethical compass that says you're going to do right by this person.
That's right.
And also getting them to look at patients as a person. I always tell my students, this is not patient whoever, this is not room 202. This is somebody. Mm-hmm. Like, whether you see them, come visit them or not, this is somebody. And when you take care of them, you need to take care of them like they're somebody. But my students, when I was in the classroom full time, my students would keep telling me, you need a YouTube channel. You need a YouTube channel. You need to open your own school. I'm like, I'm not opening my own school. That's
maybe. You
get the grant writers. But on the surface, I was like, I'm just going to get you all through this class and we're going to get through this NCLEX. Because then we focus on my class and I'm like, really? This class just gets you to the NCLEX? Because they're like, well, what is your focus? I'm like, for you to pass the NCLEX. It is not these classes you have with me. These classes are a requirement for you to be able to sit for the NCLEX. But I have not done my job as your nursing instructor until you sit for that test and get your license. You can pass this program, and if you don't pass that test, you don't get to practice as a nurse.
Right.
So I never lost focus of the end game, because the students get focused on, I got to pass this class. And I get that, one goal at a time. And I'm like, I get that too. But my goal, my focus for you is connecting the dots, because I know the test is waiting for you. And the test is never on the last class you took. The test is on your nursing program.
Right.
And, as they're kind of going through bit by bit, they lose sight of that. But I'm like, no.
I think
old stuff, which they hated.
I think it's interesting that when you know, the thing that you said about when no one's watching you,
Yeah.
cheaters never win and winners never cheat. I'm a firm believer in that. And so I'm a firm believer that you have to ensure that things are moving forward and you have to ensure that your patient is being taken care of. Are you okay? You have to ensure that your patient is being taken care of. So you want to make sure that um, you know that is happening. So tell us about your shirt today this morning.
Yeah, so my shirt, I was like, Viola's gonna be like, what is going on with this girl? So I have on my little lightning bolt shirt because that is what I want at the breakdown. So outside of breaking down nursing content for students, I want them to have the aha moments, those lightning bolt moments that go off. I want them to have breakthroughs in addition to having this content finally make sense. Because it's so many things in nursing and healthcare in general that build on each other. You know, we teach a lot of times, although a lot of nursing programs have moved to more of the concepts of what's going on. When we learn those systems, you learn them kind of individually. So I learned the respiratory system and I learned the cardiovascular system and I learned the kidneys. And then we still have to put it all together for them because the systems work together. There's not one system in the body that does not have an impact on another system in the body. And so getting them to understand all of those things and really see how it works together. The reason why if you have a respiratory issue, it's going to have a trickle down effect possibly on your cardiovascular system. If you
Mm,
have a cardiovascular issue, how it can end up being a respiratory issue. If you have a cardiovascular issue with poor perfusion, how that could affect your kidneys, high blood pressure.
mm-hmm,
You know,
mm-hmm,
I would tell them with kidneys and high blood pressure, it's like what came first, the chicken or the egg? Did
mm-hmm,
high blood pressure damage your kidneys, or did kidneys issues give you high blood pressure?
mm-hmm.
But it's just that understanding of how it all works together so that it clicks, because it has to click for you in nursing. It has to click where you see, well, I know that these could be the things that are contributing to this, but I know these aren't the only things that could be contributing to this. So you got to kind of think past the surface, but it has to click for you. You got to have those aha moments, whether it's finally learning and understanding how to properly study, um, how to finally, I call it the matrix. Nursing tests are the matrix. And once you can see the matrix, you can finally pick the right answer, which typically starts with trusting yourself, which nursing students do not trust themselves. I've had so many students go, well, I mean, I thought that was the right answer, but I got to that so quickly, I knew it must be wrong. Well, like, that's not a rational answer. Like, it's not rational. That's nursing student thinking. I'm like, you studied, you paid attention, you took notes, you put in the time. You should have come to the answer relatively
Exactly.
quickly. It's so many things that break down a student's confidence in nursing school that I'm like, you've got to build up your confidence. So I also teach certain strategies so that you can believe that you are right more than you're wrong. And you got to be purposeful in that.
I think it's interesting, you know, how you were talking about because I remember being in nursing on the back end doing the readmissions manager, and we were looking at CHF readmissions because CHF readmissions are high on the bar and they cost us more money than anything else, right? And
Yes.
so CHF could be affected by your obviously your lungs, right?
Mhm.
But then affected as well by your kidneys. So then you had to decide whether your heart, I'm sorry, say it just by your heart and your kidneys. And so you had to decide whether you're taking them to the cardiologist or whether you got to go to the nephrologist, right?
Yeah.
And so it's so complex. And so I can see why, you know, nursing students, you know, I wasn't, you know, way back when I didn't think that deeply. It's like, look, you can't breathe. Okay. I know that we have an airway issue. I
Right.
know we need to take care of that right now. You
Right.
know, so you know, understanding that I think is key. But I wish that I had someone like you whenever I was getting ready to take my NCLEX, right? The first time I went and took my NCLEX, I was 19, and I was just like, if I pass this thing, I pass it. And my
Right.
mama, she was the one that was more excited about me passing
Right.
it anyway. And then she was like, you passed. And I was like, great. And then that second time, I remember going into that thing. It was hilarious. It was the funniest thing. Because I go in there, I get in and I sit down, and I have 210 questions.
Mm-hmm.
And I'm thinking, I know I ain't passed this test. I'm absolutely fairly sure I have not passed this test. So I remember going to it was in Raleigh, North Carolina, and we went to PF Chang's. One of my friends, her name was Wanda. We sit down, we're eating. I can barely eat. And then we get in the car, and I'm just like, I don't want her to see me cry. So, I'm way back when, caring about what folks think. Don't care about what folks think now. But anyway, so caring about what folks think, because I would have had a full-fledged cry. And so I was sitting there, and I was like, don't cry, don't cry, don't cry. And so we get into the car. I mean, these are real emotions that these nurses are going through right here, right?
Mm-hmm.
So we get into the car. I get into my car because we back to Rocky Mountain. I lived in Torrey at the time. And so I get into my car, and I have a full-fledged meltdown. And I get back to my home, and my husband, he was like, what happened? And I was like, I don't think I passed the test. he said, well, did you know that you passed the test or not? I was like, I don't know.
Yeah. Yeah.
And so I got back, and sure enough, 2 days later, of course, you can call at that point in time.
Yeah.
Call said Viola. At that time, it was Viola Williams. Viola Williams, sorry. And so I was just like, yeah! And it was so funny because I had a friend that was walking in the house at the time that I had just found out. My daughter was sitting on the couch, and she was like, what's happening? She's crazy. So anyway, those are the emotions that you go through.
Very much so. And I would tell my students, so I would always prepare them for the maximum number of questions. Like, they know, because our NCLEX is a computer adaptive test. So there's a certain minimum number of questions that you can get. And if you're doing well and you have made it to the threshold, it'll cut off. And then there's the maximum number of questions. And then, back then, it was also any number in between that it could turn off. And so I would tell them, because of the anxiety you feel, this is a high pressure situation. Your license is literally on the line, or whether you pass this thing. They would go, so, should we go in, prepare for the minimum number? I would go, absolutely not. Absolutely not. Now, what I knew was that's how I prepared you. I'm never going to tell you that. I have prepared you to get the minimum number of questions. That's the intensity that I have, because I need you to have not wasted your time and your money to not pass these boards.
That's right. So, that's right.
So I'm intense with some humor, but I'm intense because I understand the gravity of the situation. And, they're thinking about capping and pinning. And I'm like, that is nice. And that's cute. And that is, that is a little bit of our culture, that we have that. And that is great. But that doesn't get you a job.
That part.
Got to pass that test. So I would tell them, when you go in for that test, you need to be mentally prepared to sit for the maximum number of questions. And I would tell them, the reason why I'm saying that is because you can pass at the maximum. Did I say maximum or minimum? The maximum number of questions. You can pass at the maximum number. Because what I don't want to happen is you fixated on that minimum number, and the next number comes and you freak out and you take yourself out of the game. I said, if you're there sitting and you're mentally prepared for the maximum number of questions, I can tell you that the number after that is never coming. That's right. I can guarantee you. Guarantee, it's not much I can guarantee you, but I can guarantee you that number is not coming. If I tell you to go in there for the minimum number, I can't guarantee you. I can't guarantee you that. And I don't need you to psych yourself out When all you do, I said, you just click until it turns off and you're mentally prepared. Quit looking at the numbers. You just clicking and you're answering until the thing shuts off.
That's
Don't
right.
look at those numbers. Now, what would happen is I would tell you, because I ended up teaching the back end of my nursing program on nights.
Mm-hmm.
And so when they would meet me, they would be stuck with me for about 30 weeks. This was a accelerated practical nursing program. So once you met me, you stuck with me. Um, but we're going to get you through. And I would say over 90% of my students, I would always have one student who didn't get the minimum number of questions. But all my students that I taught on nights passed their boards. And typically, it would only be one who didn't pass with the minimum number. Everybody else would get the minimum number, text me, and freak out.
I got the minimum number.
Okay,
Am I gonna pass?
and I know the freak out. I don't tell them what it's like because I got the minimum number too, because I was prepared for the next one and it was like, thank you. And you're like, but I don't know if I really meant that last answer. Like, so I knew what it felt like, but I'm like, that's better. That is better because the way we prepared you, if it cut off at the minimum number, you pass. I just can't tell you that. I know how we prepared you. But with the people who would get the additional number, at least I know that they didn't psych themselves out because they were mentally prepared to be there to the end. They were mentally prepared to be there to the final question that this NCLEX could possibly give you. And it's those kind of things that I feel like you got to give your student a fighting chance because it is a stressful test. And there's no indication because we do tell them, you don't know what the NCLEX believes is a hard or easy question. You don't know. So you can't go, okay, those were easy. Now, ooh, that was hard. Maybe that one's easy. So maybe I didn't get the last one right. It's so many psychological games that you can play with yourself taking that test. And I'm like, you're just answering the question in front of you. That's one. And you're mentally prepared to be there to the final question. That is all. That is all you need to do. And of course, your prep work of getting used to taking that many questions because, you don't typically take a 200 question test.
Right.
So getting them also to get used to that volume so that they don't get fatigued if they end up with the maximum number. I've had a former student, have the maximum number of questions. She passed. I've had a student who ran out of time. She passed. But they were mentally prepared for all of the scenarios, So just trying to help them, just really trying to help them get prepared for that test, for life as a new nurse, and for keeping patients safe.
That's right. I really like how you're doing it, and the value of it is number one. It's not just for the NCLEX. It's for any certification that you get after then. Because I remember getting my CEN and not passing on the first time, but I was not taught how to study in the way in which you're teaching how to study, right?
Mm-hmm.
Teaching how to study, teaching how to pass the test, understanding the psychological things that come along with it, because if you're not surprised by it, then you can get past it.
Mm-hmm.
So, thank you, thank you, thank you. I've always thought that you were brilliant. But the more I talk to you, the more that I know that you are, and you're super funny. So I want you to go and follow Kendra. She's on TikTok at The Breakdown. What other platforms that you're on?
So also on Facebook.
Okay. The Breakdown as well, right?
Mm-hmm.
Correct.
You can also find me on LinkedIn, and YouTube is coming, so I can make a playlist for videos. I try to make it make sense Mondays, and we work it out Wednesday. So YouTube is coming as requested by former students. The playlist is coming. I'm unable to make playlists on TikTok at this time. So I know that I will be able to make them on YouTube. So I have quite a few videos right now. So I'm coming on YouTube, a YouTube near you.
Sweet, sweet. I love it. I love it. So thank you, Kendra, for coming. So we have the Nurse Recharge Summit that's coming up April 23rd, 2022. We'll be learning how to recharge the nurses and how to transition into entrepreneurship if you choose to. So come and join us. It's been an amazing time talking to you. And anybody in the audience, if you want to comment, if you want to find Kendra, tell them exactly where they can find you at.
So you can find me at www.thebreakdownllc.com.
Okay.
On there, you can find my Calendly page. You can book a free, free 99, free consultation with me. I'm here also not only for students, but also faculty, because being in these teaching streets
Can be tough.
Okay. Yes. It's a lot of different factors that you are facing in the classroom, because I would say you have, as a new instructor especially, you have your own anxiety, but then you have all of your students' anxieties, and that gets ramped up whenever test taking comes. So, I know a lot of new instructors deal with imposter syndrome. Of feeling like, can I really teach them everything? Because we don't specialize in everything. But as a nursing instructor, sometimes in these programs, like I taught everything. I taught maternity and pediatrics, but I taught everything in this program. So how do you do that, and having the confidence to know that you made it through nursing school, you already taught this stuff. So it is developing ways to teach it so that it makes sense for the students, and that takes some strategies.
And I think, one of the things about imposter syndrome, now that we said it, is that whenever you have imposter syndrome, it's understanding that you need to be in continual learning, number one, but all you have to do is be one step in front of them. And you are definitely that as an instructor. And so that's important for you to be able to do that. So I love it. Thank you, Kendra. You have been phenomenal.
Thank you for having me.
You are phenomenal. You have a great rest of your day.